I'm Dr. Dharmesh. I'm a practitioner in Ayurvedic medicine. It's a Vedic science. I'm just incorporating Vedic science with the modern techniques like modern biomechanics. I'm a graduate in biomechanics also and kinesiology. Ayurveda is very olden science from 600 BC. It has its own special effects and then so many branches and then so many varieties of treatment to heal the people. Treatment will be divided into 3 stages: pre-operative, operative and post-operative. Marma, it's a vital point therapy. There's totally 107 vital points mentioned by Acharya Shushruta and Vakpata, like that. Then these vital points are present all over the body, and then they just explained its vital energy, the prana. Challenging thing for the sports people is muscular knots. And these muscular knots can be relieved by Marma very easily by the technique called cupping. The cupping is done by 2 methods. It's called as wet cupping and then the normal cupping. Normal cupping can be done on the surface and deep muscles, and the wet cupping can be done to increase the circulation and takes the vitiated blood that after any injuries, any clots and swelling, inflammations, this wet cupping is very good to do to take out the inflammations and pain.
My name is Sridhar. I'm from Southern California, and I moved to India about 7 years ago. I've been running doing long distance running, mostly marathons, over the last 5-6 years. And right now I'm training for a marathon in 2 weeks, and yesterday when I was running I noticed some knots. I felt some pain in my right calf, and I've had this before in different parts of my legs where the muscles develop knots, and then that kind of pain develops, and so that's why I came here.
So it created a suction pressure. You can see the muscle inside is pulled deeply. Marma Sikicha mainly gives more importance for the spine because the flow of energy from the brain to whole body, it's a pathway of flowing of energy. The spine is a pathway of flowing of energy. Gives more importance to the spinal alignments and then spinal manipulations. If the alignment in the spine is not in the proper way, mainly atlanto-occipital junction, cervical thoracic junction, and then thoracic lumbar joints and the lumbosacral junction.
What causes aches and pains in our back, neck, legs, arms, head, and joints? What is the source of these problems that can become so detrimental to our quality of life? Why live with pain as so many of us do? Many of these problems can be associated with the imbalance of the spinal column. The spinal column is a tunnel of interlocking bones called vertebrae that protect the spinal cord. The spinal cord is an extension of the brain, together known as the central nervous system. There are spaces between each vertebra, allowing nerves, which are extensions of the spinal cord, to supply and connect every part of the human body. Therefore, it is the nervous system that regulates and affects all body functions. The nervous system can be likened to a major superhighway. Without problems, and all vehicles going the speed limit, travel is smooth and without accident. However, if there is a car crash, traffic slows down and even stops. The highway does not function as it was intended. When the spinal column is misaligned and out of balance, the nervous system is unable to function as it was intended. Many years of clinical research point to the fact that much of the problem associated with spinal misalignment and its consequences can be associated with the atlas vertebra, the top cervical bone in the neck. This one bone can affect the alignment of the entire spine. The spine is like a chain. When the first link is twisted and turned, each link down to the last turns, thereby disrupting the rest of the chain. Consider the atlas the first and therefore the most important link in that chain. The human body is balanced when the head is positioned in the center of the feet. When the atlas is misaligned, it causes the head to tilt. The spine then shifts to support the weight of the head, thereby creating biomechanical and postural stresses and strains. When the atlas bone is properly aligned, that is, in the orthogonal or neutral position, the rest of the spinal vertebra come into better alignment, allowing the body to heal itself. The delicate and complex connections of the nervous system allow communication between the systems of the body. An examination of the anatomy of the atlas vertebra reveals that it weighs a mere 2 ounces, and the human head weighs 9 to 17 pounds. Hence, the likeness to Atlas, the figure in Greek mythology who carried the world on his shoulders. The atlas is located directly under the head, connecting the head to the rest of the spine. The atlas supports the weight of the head most efficiently in the orthogonal or neutral position. Atlas orthogonal is an engineering term referring to the position of the atlas being 90 degrees to the head and neck. Trauma in one form or another is the primary cause of misalignment. When the atlas vertebra is subjected to stresses and strains, it may be pushed out of proper alignment. Trauma may include car accidents, no matter how minor and regardless of immediate symptoms, slips and falls, blows to the head, or sports-related injuries.
Entweder durch eine seitliche Verschiebung oder durch eine leichte Drehung seine eigene Achse. Diese Fehlstellung kann durch verschiedene Ursachen hervorgerufen werden. Vom klassischen Schleudertrauma infolge eines Autounfalls, einem Sturz als Kind, der unbemerkt geblieben ist, oder vielleicht als Folge eines Traumas bei der Arbeit oder beim Sport. Aber auch eine schwere Geburt kann beim Säugling Gelenk- und Muskeltorsionen erzeugen, was eine Atlasfehlstellung schon von Geburt an verursachen kann. Gelangt der Atlas aus seiner korrekten Lage, verhärtet sich die obere Nackenmuskulatur in dieser Position. Dazu kommt, dass die Bänder, die den Schädel mit dem Atlas verbinden, extrem starr sind. Der Wirbel bleibt permanent falsch ausgerichtet. Die Diese Fehlstellung kann im Laufe der Zeit eine Vielzahl von zunehmend schwereren und schmerzhafteren Beschwerden auslösen. Oft ist die Ursache unbekannt und so bleibt nichts anderes übrig, als die Symptome zu lindern. Kommt, dass eine Fehlstellung des Atlas das Gewicht des Kopfes ungleichmäßig auf die Wirbelsäule überträgt. Der Versuch des Körpers, dies zu kompensieren und das Problem zu beheben, verursacht ein Ungleichgewicht, das auf den gesamten Muskel-Skelettapparat übergreift. Genannt wird dies dann funktionelle Skoliose, Schulterschiefstand, Beckenschiefstand oder Beinlängendifferenz. Gleichgewicht überlastet bestimmte Muskeln, die sich daraufhin verhärten und dadurch Druck auf Nerven und Blutgefäße ausüben.
Hi, I'm a golfer, and a few months ago when I was playing golf, I started noticing a sharp pain in my left wrist, especially when I was drawing the putter and starting to putt. It became agonizing. I could not even hold the putter, and it started affecting my iron play. I thought it was just a wrist injury and applied some local medication to see if the pain will go away. After about a week, the pain did not subside. And as I was talking to him, he completely ignored my left wrist and reached out for my neck. And he said, "Sir, this is a problem in your vertebrae." And he said, "I'm going to, give you a session now, and maybe 2 to 3 sessions after this, and this will get rid of your pain." Started massaging the neck area between C3, C4 vertebrae, and miraculously within 10-15 minutes of the session, my pain had started subsiding, and at the end of the 3 sessions, I got rid of the pain completely.
Golf is my hobby, and I've been playing golf for the last 25 odd years. I had a major issue when I had a pain in my hand, which I dismissed off as a golf elbow problem, which comes very often and goes away. The pain extended to my shoulders and to my back, upper back, vertebra, and I was under severe pain, and apparently I couldn't play, and apparently there seemed to be more an issue than just a golf elbow. He calls it a sort of a temporary spondylosis type of a problem because of a bad swing, which created this issue. I was perfectly fine within 2 weeks.
Injuries in the joints like swelling, inflammation, clots of the joints. We have like Lepana technique. this is one kind of dry needling technique, and it will be mainly done to remove the very deep knots in the muscles, like very tough muscle, and then which has very deep interseated knots. If you want to release in hands, it will take manipulation technique or Marma, it will take almost 10 to 15 sittings time to release these kinds of knots. And then these techniques also explained by Acharya Shushruta in his 8 type of surgical methods. One is Vyadana, done with suchi, this needles. It's mainly to puncture, they say like that.